So what are the goals and the benefits of weight loss surgery? Again, it's not a miracle cure. It does allow you to control appetite and thereby reduce your intake and lose weight, and it's very effective. You lose weight and then you maintain that healthy body weight, and with that most people get improvement in almost all of these problems. Most people who've been on insulin with diabetes for less than 6 years are able to come off their insulin more than 80%. People who are on oral medications for diabetes, again, about 80% of them are able to come completely off of that. And those folks who don't come completely off their medication often will be able to go to a much lower dose, or even to one medication if they were on 3, what have you. Most people with sleep apnea are able to come off of their machine, but I recommend certainly that people do that only under doctor's supervision. That usually doesn't happen as quickly as some of these other problems resolving. That's usually several months out, even up to a year, before your apnea improves to the point of really making big changes. High blood pressure resolves in about 60% of people. About 40% of people will still need to be on some medication, but it's usually much less. If you're on a diuretic pill, a water pill, we do ask that you try to come off of that first, because we don't want you dehydrated, and certainly kidney stones are a worry if you're over dehydrated. High cholesterol and lipids improve, more so with the gastric bypass in a very early fashion because of that absorptive issue, but even improve also with lap band with weight loss. That's a little slower with the band because it's not just related to the surgery, it's related to the weight loss. Arthritis, asthma, reflux all improve. One word about reflux is that some people, very few people, but some with a band will find their reflux is worse. Most people have a great deal of improvement. That is one area though where we try to individually counsel people. If you have reflux, just to be aware that a few people who are unable to tolerate a band, it's reflux related. Infertility, as we spoke about earlier, people often who have not had a period in several years, even before they have a regular period, can have an ovulation cycle, and that means they can become pregnant. And you do not want to become pregnant 3 weeks or even 3 months after gastric bypass surgery. So we really stress that you be aware of that in the short term. Certainly if you're trying to have kids and you want to become pregnant, having that infertility improve will be a great thing in the long run. Urinary stress incontinence improves and goes away in many people. Depression and anxiety improve. We do want to stress for people who have psychological issues that they not stop their medications. Most people will need to continue medications lifelong, but they will see improvement. Now, any procedure that we do, whether again it's a hernia repair or an appendectomy or any operation, we need to talk about risks, the benefits, and the alternatives. And we talked about the benefits to a large extent already. The risk of any operation on the abdomen, the #1 cause of death is a pulmonary embolus. That's what PE is here. That's a blood clot that starts in your leg and goes up to your lungs and can block the lungs off and the outflow of the blood from the heart enough to kill you. That's the most common cause of death for bypass or band. It's actually the most common cause of death for most abdominal operations. So that's why we stress the walking, and that's why we have stockings on your legs while you're asleep to squeeze, and we usually give people a very light blood thinner as well. All of these risks we work very hard to reduce, to minimize them. We can never make them zero, but we want to make them as close to zero as we possibly can. And that's where we do have to individualize with you as well. We have things that we do for everybody, but if someone has individual personal risks that are higher, if you've had many blood clots in the past, we definitely want to know about it. There are other things that we can do even additionally for you in coordination with your doctor. If you're a Jehovah's Witness, on the other hand, and you really want to have absolutely minimal risk of a blood transfusion, we might back off and not give you the blood thinner part of that. So we do individualize on all these things. Anastomotic leak, that's where we've sewn bowel or stomach together. If it fails to heal, then it opens up and fluids can leak out. That happens in about 1 to 3% of people. It is not a death sentence. Most people with a leak do not die. However, it certainly can cause big problems, and it's not something that you're going to go home from very quickly. We do have techniques that we use in the OR, techniques that we also use even after the OR to minimize that chance. Bowel obstruction is a blockage of the bowels that can happen from scar tissue or kinking of the bowels either early or late after any abdominal operation. The gastric bypass is a complex operation and does have a higher rate of kinking of bowel than like an appendectomy or a hernia repair, though. You do need to be aware of that. Bleeding can happen with any procedure, any operation that you have. That is the one complication that we do actually increase the risk just a tiny bit with giving you that blood thinner. Again, if you're a Jehovah's Witness, we don't want to increase your risk of bleeding. Very few people do have to have a blood transfusion, even if they do have some bleeding issues. And many people have a small bit of oozing at the Band-Aid sites or at the incision, but certainly very rarely that you need a blood transfusion. Infections can happen with any operation. There's a little higher risk with gastric bypass because we are dividing bowel that does have some bacteria. This is not a high bacteria area of the bowel, however. Pneumonia can happen with any operation, and we work hard to get you to be able to breathe deeply. Heart attacks can happen. Many of our patients have a high risk of heart attack on any given day, and certainly this is a little more stressful than the average day. So we do want to work with your primary doctor to minimize that risk. Dehydration can happen. And then here at the bottom, this is what I say pretty much to anybody anytime I do an operation. And I've had surgeries on myself. You can die. It can happen. However, it is very rare. And I always like to tell people, and I've gone to sleep for surgery, you always worry about waking up dead. And it almost never happens. Where people die more from surgery is really later down the road, either from a blood clot or heart attack, or even if they have a leak, it's not in the operating room usually. Worse than death for some people is permanent disability. That's very, very rare, but you can have a stroke, or you could have a problem that leaves you permanently disabled that some people would consider worse than death. Again, that's very rare, but it's always a possibility. Now, late lifelong complications that can happen, especially with gastric bypass, is ulcers, where the bowel is hooked up to the small pouch of stomach, especially for smokers. It is so critical to stop smoking forever, especially with gastric bypass. This can happen even years and years later. Bowel blockages can happen. Malnutrition can happen, as we discussed earlier. Bands can slip about 1 to 3% of the time, and that's not always an early issue. That can happen years later, where the stitches that hold the band into place can break down, especially with uncontrolled, prolonged vomiting, and that stomach can slide up through the band. Usually that can be solved with a brief operation to pull the stomach back down and sew it into place, or put a new band on. But it does require an operation. It's not something that gets better on its own. A band can erode into the stomach. If you've seen it's a foreign body, it's very rare for that to happen, less than 1 in 1,000. It's actually 0.1%. I need to change that slide. Skin fold problems, people who have a great deal of excess weight, and even people who aren't as overweight can get excess skin, and that's a problem that can be fixed by plastic surgeons. However, getting insurance to cover it is variable. Weight regain is always a possibility. You definitely do have to use the tool. It's pretty rare with our current techniques, but it's certainly a possibility. Now, I put that on there also. If you have late weight regain, it's not something to be embarrassed about with the program or with your doctors. We work for you, and if you have regain, we really want to see you. We want to see you regularly anyhow, as I'll talk about later for lifelong follow-up. But we really want to help you through this issue. First of all, it may be that your tool is broken. Like I mentioned earlier, with the current gastric bypass, that tool rarely breaks, but there are some things that can happen that you really need to have investigated with your surgical team. With the band, there are things that can happen where it doesn't hold the fluid, and with older techniques, those staple lines can break down. So first of all, it could just be the tool that's broken, not you. And second of all, life is still life. Life is still stressful. It's a long journey, and if you come into socially stressful situations, if you have grief issues or life-changing issues, and you find yourself not using the tool for a while and regaining weight, the tool is still usable. you don't have that initial honeymoon phase where there's sort of automatic weight gain again, but you can relearn how to use the tool in a functional way, and we do that with you. It's not something I recommend anybody try alone. So if you have regain because you know you've been naughty, you've had a divorce or a job change or a move, you haven't lost your chance. These tools are usable lifelong. So again, I'd just like to go over this formally. We always like to talk about risks, benefits, and alternatives with any therapy. That's true, as those of you who know who are on fen-phen or other medications, boy, there are risks with pills just as much as there is with surgery. People can die from pills, but surgeons seem to be the ones who are the only people talk about this. So we've talked about risk, we've talked about benefits. If you have questions, and this is a general discussion, I can't stress enough that your consultation is an individual discussion of these general issues, but customized to fit you. So any questions you have about your health, any questions you have about risk that you particularly consider very important, you should talk to us about. Again, we have some patients who just by no means ever want to have their bowel divided, and they just won't have a gastric bypass. That's fine. We can discuss what the options are with the band for that individual, and most people, that's fine. Some people don't want a foreign body under any circumstance. They only want a bypass. As long as it's medically responsible, most people get to choose. There are a couple of medical things that really make one or the other sometimes a bad idea. We'll discuss that with you individually. These individual issues sometimes involve family. We're not here to disrupt your family. We want to help you live with your family happily. So if you need to bring them in and be educated, take extra time. We're not in a rush for this. This is not an emergency procedure. So we will work with you individually on those issues. And I really want to stress that you feel comfortable bringing your individual issues with us, bringing your family in if they have questions or need education. That's part of why we're doing this information session on the internet, so families can watch this without having to necessarily come in and take a day off of work or an evening away from the family to see these issues discussed.